Hello, everybody. Today I will present my case report about reconstruction after basal cell carcinoma recurrence on the medial commissure of the eye. Regarding the basal cell carcinomas, they are the most common malignant tumors of the skin. The main risk factors include sun exposure on light skin types, but also chemicals and genetic factors play a role. There are several subtypes, and the clinical evolution and complications highly depend on the exact subtype of the basal cell carcinoma. Regarding the patient, we report the case of an 61-year-old man with a known history of cardiovascular disease and multiple recurrences of pseudoadenate basal cell carcinoma. He was admitted with a tumor on the medial canthus and the skin of the upper and lower eyelid on the left eye. The tumor was revealed to be a local recurrence of previously excised basal cell carcinoma affecting the same area. Here we have a picture of the initial tumor. Regarding the treatment, the management of the medial canthal area and eyelid is complicated. The complete removal of the tumor might be challenging, and it requires complex surgical techniques in order to reconstruct the area. The patient underwent surgical excision of the tumor within the limits of oncological safety. The tumor invaded the nasal bone and caused osteolysis, therefore, curettage was used to remove the affected area. For the reconstruction of the area, a rotated glabellar skin flap was used. The flap was viable and the capillary pulse was normal. Here we can see a picture of the rotated glabellar flap in order to reconstruct the area of the medial canthus. The results. They have been successfully, and the patient was discharged with highly recommended surveillance. The recurrence rates for basal cell carcinoma seem to be high, and the patient is at high risk since he presented with several recurrences already, whereas the last recurrence was observed 2 years before. Poor patient compliance can lead to complications and negative outcomes. Therefore, long-term follow-up is mandatory to early recognize local recurrences. This was my case report, and I hope you enjoyed it, and thank you for your attention.